SWC Search has gathered UCLA students from Switzerland, Sweden, Malaysia, Brazil, and the United States to discuss health equity around the globe. Health equity is defined as the absence of unfair and avoidable or remediable differences in health among population groups defined socially, economically, demographically, or geographically.
Hi, I'm Jill. I'm a third-year neuroscience major from Switzerland, and my preferred pronouns are she, her, and hers.
Hi, my name is Risa. I am a fourth-year anthropology major and a global health minor at UCLA. My pronouns are she, her, hers. A little background about me. I have two Japanese parents, and I am born in Japan. I moved to Sweden when I was 6.
Hi, I'm Sarah Zari. My pronouns are she, her, hers, and I am a second-year biochem major. I'm from Kuala Lumpur, Malaysia, which is the capital city, and I grew up here and I pretty much have lived here for my whole life.
Hi, my name is Carolina. I am a fourth-year psychology major at UCLA. My pronouns are she, her, hers, and I was born and raised in Brazil.
Hello, I'm Desiree Shragi, and I use she, her, hers. I'm a freshman pre-majoring in psychobiology, and I've lived in Los Angeles my entire life. Considering that, I'll be the United States ambassador.
My healthcare system views health as a human right.
I strongly agree. In Switzerland, healthcare is universal, and everyone has access to healthcare provided by taxes, and everyone's taken care of.
I agree because Brazil has a public healthcare system, so like on paper everyone has access to healthcare, but what happens is that as much as we do have a public healthcare system, people don't really have access to it because we don't have infrastructure, we don't have doctors to tend to the Brazilian population, which is enormous. And so even though it is like universal, people still have a hard time getting access to good hospitals and doctors.
My country's dominant cultures play a large role in the structure of our healthcare system.
I feel like a large part of the universality of basic needs, education and healthcare, it stems from the country's history of kind of social democracy, normalization of welfare, and belief in equity between different population groups. For instance, my peers and I in school, it was normal for like a male teacher to not make it to class because he was caring for his kid who was sick. Like we have an official law that allows that. It's called FOB. It's like a good contrast to the U.S. healthcare system, for example, and maternity leave.
I agree. I think that Swiss culture is very much about social justice and equality, and that definitely plays into having an amazing healthcare system.
I agree with this statement. So Malaysia is a predominantly Muslim country, so religion does play a big role in the policies that this country makes, including in healthcare. And an example of this, I'd say, would be how abortion is generally illegal for everyone here, unless the pregnancy poses a harm to the baby or the mother. So I'd say this is an example of how culture plays a role in the healthcare system.
Yes, I strongly agree because I know that Brazil is very patriarchal, and abortion's not legal. And a while ago, we had a really sad case of a really young girl that was raped, and still like more than half of the country wouldn't support her getting an abortion. That was an extreme case, of course, but it still shows how like behind we are in terms of healthcare for women.
I have found it easy to obtain medicines, prescriptions, and lab testing, including COVID-19, when in need of it.
Although I personally agree that I've been fortunate to obtain medicines, prescriptions, lab testing when I am in need of it, I recognize this in no way reflects America at large and the struggles many Americans have had in obtaining anything from a COVID-19 test to visiting the doctor on a normal daily visit.
As for COVID-19, as far as I know, both testing and the antibody tests are widely available to those who want it. I personally gotten an antibody test in October. I knew that it's been available from May. I think the first 3 times are free, and then you have to pay a small fee to get it.
So when I lived in Brazil, it was pretty easy, but that was because I always had a private healthcare, private insurance, but I know that is not the reality of a lot of people. There was a lady that worked in my house, and she would wait a couple months to get a certain prescription.
Finance is a barrier to receiving care.
I strongly agree. If you depend on public hospitals, the chances of you receiving proper treatment, they're really low. So if you have money in Brazil, you pretty much can do anything.
Finance is a huge barrier when it comes to healthcare in the United States. People have to pay to be able to get that healthcare that everyone needs as a human right.
My country's healthcare system has been overwhelmed due to COVID-19.
I think that's neutral because right now their cases are picking up. I would say that the second wave definitely has hit them a little bit harder than probably anticipated.
You're completely overwhelmed due to COVID-19. It has recently come in the news that asymptomatic healthcare workers are still working in the hospitals treating COVID patients because we are that overwhelmed. Countless Americans, over 200,000, have died due to the coronavirus, and even more are suffering from now what has become pre-existing conditions that will not be covered by a majority of healthcare insurances.
My individual concerns are being addressed and represented in public health policy.
For me, it's neutral. I've always had private health insurance in Brazil, so I didn't really depend on public health policy. I know that a lot of people that do depend on the public health policy wouldn't agree with this statement just because we don't have infrastructure and because Brazil is a really corrupt country, so all the money that should be going to health is not. And so people don't get what they need from the system.
Not a single person that I've talked to, unless I brought it up, talked about the immigrant population that has been affected a lot by the pandemic, especially in suburbs of bigger cities where there's a lot of immigrant groups live in clusters. It's like a little community.
Yes, there are initiatives in Switzerland in order to make individual concerns a theme for the public. However, I think that since I'm a neuroscience major, mental health concerns could be given a little bit more emphasis.
My country's healthcare system has adequate accommodations for people with disabilities, LGBTQ+, and other minority groups.
I think that definitely is a little bit more on the conservative side.
My perspective is that my country does offer some accommodations to those with disabilities, those within the LGBTQ+ community, and those within other minority groups, but by no means do I believe these accommodations are adequate. Those within these communities are by no means accurately represented by healthcare officials who are in control of how these accommodations operate.
I disagree with this statement. As I have also mentioned before, Malaysia is a predominantly Muslim country, and religion does come to play within the healthcare system here. And because of that, minority groups such as LGBTQ+ groups do not have proper accommodations for healthcare within the healthcare system in Malaysia. And as I've also mentioned before, the healthcare system does not really cover non-citizens within Malaysia, such as migrant workers in Malaysia. So I would say that Malaysia does need to provide more adequate accommodations for LGBTQ+ people and minority groups within Malaysia.